Iván Schwartzmann, urólogo de la Fundación Puigvert, el responsable de del área de HBP, que nos va a dar una charla que yo estoy deseando ver de los morcelladores available y de cuál es el estado actual, porque para mí el key point ahora mismo, el problema no es el láser, que creo que hay muchos y buenos, sino el morcellador. A ver qué nos cuentas, Iván. Bienvenido y muchísimas gracias.
Muchas gracias. Thank you for the invitation. I prepare my talk in English. And in the next 10 minutes, I'll talk about what is the perfect morcellator for you, probably, your perfect match, I would say. I have no conflict of interest. When you look at the ILUTS program, probably morcellation is not the most attractive talk in it. Why is that? Because no one likes morcellation. Morcellation, when it goes fine, is very boring. And when it goes bad, it can be very, very frustrating and even dangerous, and you can end up wanting to throw your morcellator out the window. So, not the most attractive talk maybe, but I'll try to make it as interesting as possible. I'll talk about the available morcellator today. I'm gonna go to do an individual evaluation of each morcellator. I will try to compare some morcellators, and I will wrap it up with a take-home message, of course. So today, to the best of my knowledge, 6 morcellators available in Europe. I will divide them in classic morcellators and in new morcellators, and this division is important because of the amount of evidence. Classic morcellations have a lot of evidence for them, and you have to bear in mind that some of this evidence is with older versions of these morcellators, so just to bear that in mind. So there are different components of morcellator. Morcellators have many components, but I think 2 of the most important components that the big difference between them are first the blade movement. The blades can reciprocate, can move back and forth, and the only morcellator today that does this is the VersaCut, or it can oscillate. It can move to one side and to the other, and this is done by all the other morcellators. And the other important part is the suction mechanism. It can be achieved via a peristaltic pump, and the VersaCut and the Multicut Solo use a peristaltic pump. It's basically a wheel that rolls over a tube, or it can use a vacuum generator, creates vacuum, and all the other morcellators use this technique. So let's go into each morcellator. We will evaluate efficiency, but also bladder injury rates, malfunction, this all in the literature, and I'll try to assess a bit of the price of each morcellator. And I'll put all this data in this table that you are able to download scanning this QR code. So let's start with the classic morcellators, VersaCut and Piranha. The VersaCut was the first morcellator developed by Lumenis, now owned by Boston Scientific. This is the original VersaCut. And the VersaCut has an oscillating movement, and this can make looking at or watching the tip of the morcellator blade a bit difficult. And this maybe can produce a bit more of bladder injury we see in the literature. This is the morcellator I learned to morcellate with when I was with Dr. José Placer in Vallebron. It's a very reliable morcellator, but it has its downsides, of course. Franz and colleagues published last year this systematic review, very, very interesting, on 3 morcellators. On VersaCut, there are 17 studies with almost 3,000 patients with a median efficiency of almost 4 grams per minute, a bladder wall injury rate a bit high at more than 5%, and a device malfunction very low at less than 1%. So we put all this in this table, and the price is on the lower end of the price range for morcellators. We go to the Piranha, developed by Richard Wolf. This is the Piranha morcellator. It's the morcellator I'm using now. I think it's a very efficient morcellator, but it has many components, and there are a few tips and tricks you should know to make it work properly. So there's a bit of a learning curve. 13 studies about the Piranha with more than 2,600 patients, a median efficiency higher than the VersaCut, almost 2.3 grams per minute, a bladder wall injury rate lower at 1.24%, and a device malfunction rate a bit higher, a bit above 2%. We put all this on the table, and the price is in the higher end of the price range of morcellators. Now we go to the new morcellators, and we start with the drill cut, developed by Storz, very typical Storz design. I've used this morcellator 2 times. It has a double serrated blade. The inside is serrated and the outside is also serrated. I think it's a morcellator that works very, very nicely. Just to criticize something, I think it makes a bit of a lateral movement when you use it. as you can see in this video. I really had no problem with it, but it can be a bit annoying. Now, this is the first new Morcellator, so the amount of evidence drops. Only 2 studies with a drill cut, median efficiency very similar to the Piranha, bladder wall injury rate at 2.4%, and a device malfunction a bit higher at almost 8%. And the price range is also on the higher end of the price range. Other new Morcellator, the multi-cut solo, developed by Surgical. It has a very nice interface and it allows you to modify also the oscillation. The clinical relevance of this, well, I don't know. I've tried this Morcellator once. I was amazed by its high speed when it's working properly and it grabs the adenoma properly. It's very, very fast. The problem is that I think due to the peristaltic suction, it drops the adenoma frequently, and this of course makes the overall procedure a bit slower, but in general very, very nice Morcellator as well. Middle range in the price, I would say it is middle range price Morcellator. The jaws is developed by Hawk. This is a Chinese company. This is the only Morcellator I haven't tried personally. Very little evidence on the jaws. There's an article by he, and I included this other article even though it's not indexed, but there's so little evidence that I included it. Only 2 studies, median efficiency of 5.4 grams, very similar to the Piranha, and bladder wall injury rate of 0% and device malfunction 0%. I don't like reports of 0% complications. It makes me suspicious, I'll just say that. Okay, and on the high end of the price range of Morcellators here. And the last one is the Cyberblade, developed by Quanta Systems. I would give this Morcellator the first prize for design innovation. Beautiful design, very creative. You control everything in the handpiece. There is no pedal. You only connect the vacuum pump. So very, very innovative design. You use a battery to power it. You control the speed of the blades with this button here. You activate and deactivate the blades with this other button, and this level is for the suction. But when you use it, it is slow. It doesn't drop the adenoma often, so I think the vacuum is good. But the overall speed is a bit low in my opinion. Sadly, there's no scientific evidence that I know of about the Cyberblade. In my experience, this Morcellator would make sense for a low volume practice or for a high as a backup Morcellator because it's cheap and you can buy a small amount of these units. But I think it's probably the slowest. Of course, the lower end of the price range. So comparing head to head to them, of course, most comparisons are between VersaCut and Piranha because we have more evidence on them. There are 5 studies comparing them head to head. 2 of them show similar efficiency and 3 show the Piranha is more efficient. There's one study comparing that involves comparison between the multi-cut solo and the jaws and also the Piranha and the VersaCut. This was by Lee, published this year. It's an ex vivo trial, so it's not perfect, where 4 surgeons evaluated 4 Morcellators, and in the objective parameters they observed that the efficiency for the multi-cut and the jaws is a bit lower than for the Piranha and the VersaCut, and on the troubleshoots that maybe the jaws has the troubleshoots more like the VersaCut and the multi-cut more like the Piranha. So finally we have our table completed. We can see that the efficiency is probably highest with the Piranha and the drill cut, maybe the jaws, but the evidence is dubious. That the highest bladder injury rate is with the VersaCut, maybe due to this oscillating movement. That the drill cut appears to have the highest malfunction rate, and the priciest ones are these 3 you have seen. Very, very important to remember that the quality and the amount of the scientific evidence drops dramatically following the direction of this arrow. So now you know about the different characteristics of the Morcellators. You can go to Amazon and buy your Morcellator and be happy with it forever. If we have learned anything from this couple here is that machines break. So it's very important to know that your Morcellator will probably break and you will need a good after sales service. So this will be the last column in this table, after sales service. Of course, you have to fill that yourself because it depends on on when you work, where you live, but I think it is very, very important. You can, as I said, you can download this QR code. I'll leave it here for a while, and let's wrap it up. So when buying a Morcellator, when analyzing a Morcellator, consider efficiency, safety, reliability, of course, price, unless you're very, very rich, and also after sales service. Very, very important. If I would have to compare the old Morcellators and the new ones in one slide, probably this would be it. I don't think there's a core difference between the Piranha and the Versacant and the new Morcellators. There are some improvements, some nice features, but the core, I think, is very, very similar. Sadly, there has been no revolution in morcellation with the new Morcellators. We still have problems with very hard adenomas. We still have problems when we bite a bit the bladder, but that's my take. Thank you very much for your attention.
Congratulations, because it has been an amazing presentation. I love it. I will copy it. So I am just telling you. Unfortunately, we are very late, so we cannot speak about this, but thank you very much for this presentation that has been one of the best in this.